generally early stages, no, we can treat. The first line of treatment is nothing but the medical management. We give certain medicines such that the prostate itself will shrink to some extent, and also there are medicines which helps in increasing the better flow, so that that outflow is narrowing, it will be avoided. Whatever the medicines will improve the prostatic symptoms, that means that relief in the frequency, and also the emptying will be better with the medications. But once those medicines will not be a permanent solution, daily they have to keep taking the medicines. But those things work out in the early stages. But the prostate keeps on increasing the size, and one stage will come wherein we need to treat it, whether remove the amount of tissue of the prostate or by surgery, or we have to shrink the tissues of the prostate by doing the prostatic artery embolization.
Right. So one of the main reasons you're here with us today is to talk about the treatment prostatic artery embolization. Could you tell us more about the treatment, how it is done, and the process of it?
Yeah. See, it is very much physiological how the prostate is enlarged. Once the prostate is enlarged with the as we age in the males, so the same way we reverse the physiologic enlargement of the prostate by reducing the vascularity of the tissue of the prostate. That is process is called as prostatic artery embolization. It is entirely different method and approach, methodology of approach for the treatment, because in so highlight in surgery they remove the, but here we make the tissues of the prostate to shrink by reducing the vascular supply. How we do is we go through the arteries. That is one of the interventional radiology advancements. We go through the arteries,
Okay.
the prostatic arteries are very minute. Whether we go through the, generally we go through the hand and to the aorta, and from there to the prostatic arteries, we go and put small particles, which are minute particles, say around like 100, less than 100 microns, which will be very tiny particles. They block the tiny vessels of the prostate after selecting through the highly selective microcatheterization we do, and block only prostatic arteries, so that when the blood supply is reduced, the prostate shrinks and the catheter is removed. That will be done on either side, both the side, left side and right side, so that prostate will be uniformly shrink and the symptoms improves. Here, there is no blood loss. It is a painless procedure, and a daycare procedure we do in the cath lab, just like how angiogram is done for the heart. Prostate also we do angiogram and block those capillaries, small vessels, and then prostate will shrink, and patient will be discharged in the same day. They can go walking, come walking, go walking. That's how it is, a very simplified method of this thing with a highly effective type of procedure.
Right, that would be my next question. So, how long does the surgery take, and also post surgery, what are the care? I also want to ask our audience, if you have any questions, you can just drop it in the comments, and doctor will respond to you with all the answers. So, just drop a comment with the questions you have.
That is the, yeah, that is the specialty of this procedure. It takes very like say around like sometimes like 20 minutes to 1 hour procedure. It's a daycare procedure. Patient will be conscious. We will be talking to the patient. It will be done under local anesthesia. So it is a painless procedure. And post operatively also it won't be that painful. Very rarely we put a catheter. If the patient is voiding, we will allow him to void. We will not put any catheter. Will not touch or will not enter into the region of genital region, because we go through the arteries and block these things. So patient can be normally void urine, and they can walk immediately after the procedure. They can be usually discharged in the same day. As I said, it is a daycare procedure, and for the few days we will be keeping them on antibiotics to prevent any infection and few very mild painkillers, and they can resume to their normal life very soon. And the side effects are very less, as it is a painless procedure. Usually within 1 week the result symptoms will get improved, and their frequency will reduce, the flow starts improving. Those are all the advantages of.
Right. From what I hear, this seems to be more simpler, lesser pain, also very effective because it saves a lot of time. People can resume back to work very quickly if it is a daycare procedure. Doctor, would it come back? So another question people would have is, okay, you might do the procedure. Is there a chance of it coming back?
Yeah, that is one concern of the people I like to address. Very, very rare. Though it is 95% of the patients will be very high success rate, 5% chances what happens is some collaterals may be there, or sometimes the embolization may be not be sufficient. Those patients symptoms may recur in around 5% patient. Compared to surgery, it is far less, because even in surgery there may be a while residual tissue which can regrow. The similar way, the recurrence rate is very less compared to other things.
Okay. And what are the risks of ignoring a BPH? So some people might ignore the symptoms and say, I don't want to go to a doctor or go through any procedures. What are the long-term risks if it is not addressed?
Actually, BPH is very dangerous in the sense it will mainly the lifestyle. You know, imagine a person the entire night they will go some 10 times to the bathroom.
Right.
So, and they will lack of sleep at that age. So, which is very important, and that causes the stress in their life, and that is the main thing. Lifestyle is very important. Other thing lead to is recurrent infections. So, because it's like a stock of urine. Imagine so much stockage. Only some 10% they are able to empty as they go in the severe cases. 90% is remaining in the urinary bladder, so that it invites some infection. So because of that infection, again kidneys will get affected because of stock of urine, hydronephrosis, again urosepsis we call it as. Those infections, stones, all those things can occur with the negligence of the prostate, and not properly getting treated in a right time.
Right. You were also mentioning about the use of catheter. So what are the conditions or what kind of patients do you generally use a catheter, and does all of them need it?
No, not generally all of them. For example, patient already voiding, and that means passing urine normally, and with little difficulty, we will not put it. Only in the conditions where patient is already on catheter, we like to keep the catheter and do the procedure. Because if we remove before the procedure, already there, we call it as bladder outlet obstruction. Because prostate is so much enlarged, they are not able to pass without a catheter. In such patients only we keep a catheter. Otherwise, we don't put a catheter before the procedure.
And
So in those patients also, after we give a trial, like usually after 1 week we remove the catheter so that they
okay,
can pass urine after the procedure, prostatic artery embolization.
okay,
So
okay.
so many patients they come with a catheter with the, for the we have done the procedure, and after that we remove the catheter. They are normally able to pass the urine.
Right. That's something really good to know, doctor. Thank
Yeah,
you.
very.
And how safe is this procedure? PAE, prostatic. Yeah.
Is very very safe procedure since it is a percutaneous. We are not using any blade or anything to cut. It is painless. Blood loss is zero. So it is very comfortable procedure. If we compare it to the surgery, either TURP, transurethral resection of prostate, there they enter through the urethra. It is under anesthesia, usually under general or spinal anesthesia, wherein it is the risk of anesthesia is completely avoided. For example, a patient is a cardiac patient whom anesthesia itself is a risk sometimes. So all those things, risks are avoided in this because we do under local anesthesia. Blood loss is completely this, and since we are not entering through the urethra, infection rate is very very less compared to that. And there in surgery, blood loss, infection rate is more. And if they remove less tissue, again symptoms will recur. If they remove too much of tissues, there may be what we call it as incontinence, wherein patient is unable to control the urine. They will be passing without their knowledge, so unable to control. That is called incontinence. And retrograde ejaculation and sexual dysfunction is known in the surgery. But here in prostatic artery embolization, we are not touching any of those structures. We are how physiologically it is enlarged. We are reducing the size and making it shrink without removing any tissues. That's how the beauty of this procedure, wherein all these side effects are generally avoided.
Right. So, if a patient has undergone a heart surgery or another procedure which uses an artery to do the treatment, is it still possible that you do the same procedure PAE on such patient?
Yeah. So generally, they just enter through the artery. That's it. They enter. The stent may be put in the heart, coronary stent, but the passage will be same. So it won't affect. It is not a contraindication in case they have used the stent or not. So it's not a problem.
Okay. So now again, so for people who want to take care of themselves or prevent such condition, what would be some general advices you would like to give for people to take care of themselves?
General advices is mainly they should do routinely if there is any disturbance in the frequency of flow and flow or the reduced flow or any difficulty, they have to put more pressure, anything such symptoms comes, they should contact a physician, undergo a few tests. Generally we do like general examination and mainly the history. Any of these symptoms, we may do ultrasound scan of pelvis to look for the prostate size, and we generally see the residual urine. So if it is more than more, and then we may suggest medicines initially, and taking those things we may avoid all those complications. So in general, lifestyle modifications, active lifestyle, all those things can prevent. Since in studies they say sedentary lifestyle is one of the things which they can get the prostate symptoms early. All those things we can maintain and make a healthy lifestyle indeed better to avoid sedentary lifestyle. And as I said, more early they should contact the physician for any of these symptoms to get treated early and to avoid all the complications.
Right. Before I go on to the next question, I would like to remind our audience that you can leave your comments or leave your questions in the comment section, and doctor will respond to every question. And I'm sure at this crucial time that we're going through the global pandemic, you might be scared to visit the hospitals, but at Medfin, we ensure your experience is risk-free, and the following protocols is done before you go into the surgery: fever screening before you enter the hospital, history of past illness or fever, smell test is done, chest x-ray for patient and the attender, travel history, and location check for people who are coming from the red zones. We are not allowing them. Check with the Arogya Setu app, and only one attender per patient is allowed. So this makes your experience and your recovery risk-free, and also something that you don't have to be afraid of. And if you would like to book an appointment with Dr. Bhaskar, please call us on 7026 200 200. And yes, don't worry to come to our hospitals. We also offer video consultations, so your experience is risk free. And again, doctor, when we are talking about such condition, you said there is a part of it which could be hereditary, but mostly lifestyle issues. What lifestyle changes could somebody make to be safe?
Lifestyle means like see, for example, holding urine for long time, so sitting in one position for long time, these things, and drinking good excess clear good water, palatable water. So and generally physical activity. So being non-obese and good athletic activities, making themselves more active, physically active, that makes a person healthy not only mentally as well as physically. And this generally has shown better delay in BPH, or sometimes they may not have symptoms at all. So those things are very important. I think these modifications in their lifestyle, it's better. So now it's a COVID time also, people should not become more lazy. They have, before they used to say that no time, but the time is there, they have to utilize the time and then make them more mobile kind and active kind of behavior than the sedentary.
Right. Thank you so much, doctor, for sharing the advantages of PAE, because it is also less time consuming, it is faster recovery, it's also affordable, it is not very expensive, and it is a daycare procedure. So people need not fear about this condition, but can easily go through the procedure and get rid of all the pain and hassle this might be causing for them. Thank you so much for joining us and enlightening us about all of the information that you shared with us. Thank you so much.
Thank you very much. It's
Thank
my
you.
pleasure. And anyone who are concerned, like they can freely contact us for any doubts if they have regarding benign prostatic hyperplasia, which is very common in old age, and we'll ready to address any of their concerns anytime. Thank you.
Thank you, doctor. Thank you so much. Audience, our next session is with Dr. Vineet Manan on understanding hernia and its treatment options. Day after tomorrow, that's on Wednesday, 13th May. Please join us there. And yes, thank you so much.
Yeah, see you. Have a good night.